up tonight. Health officials say there is no evidence of COVID-19 in the northwest region. In the west region, 44 persons, including 2 French citizens who visited an orphanage, are infected. The shortage of medical specialists in Cameroon has come to the fore with the spread of the coronavirus. Just how are medics struggling in times of need? Find out right ahead. And the CPDM party has swept all the 13 seats for grabs in the National Assembly partial election rerun in the northwest and the southwest regions. The details right now. Thanks for watching the 7:30 news on CRTV. I am Moki Edwin Kinzaka in Yaoundé. The shortage of specialists has been at the center of debate among health experts as Cameroon faces one of its worst pandemics in recent times. Medics add that having qualified health staff is also as important as having the necessary equipment. With the current state of affairs, what will happen should an emergency situation arises as the coronavirus continues to spread? Cynthia Saptola has been finding out.
It's the question professionals worldwide are addressing: how to handle the shortage of health workers and specialists to manage severe cases of the COVID-19, especially those that end up in an intensive care unit.
Among those who are yet hospitalized, as the last report was stating, you have only 3 cases. It's a good news, but it doesn't change anything because the country must prepare.
For those in the 3rd and 4th stage of the virus, medics say in general terms, it requires trained professionals, typically intensive care physicians, anesthesiologists, intensive care nurses, and respiratory therapists to handle the situation.
The latest recensement of medical health workers in our country took place, I think it was 2011. We find at that time that as Cameroon was most lacking of medical doctors and nurses. So we have nurses, but truly we don't have enough nurses specialized in anesthesias and in theater. In terms of resuscitation doctors, I don't think the number can cover. We cannot be based on that to cope with this issue.
What some professionals in the nation's capital are proposing is medics already in the field be trained for the purpose rather than those with no experience.
We should integrate medical doctors that we can rapidly train, including those who went on retirement even 5 years, but who have been working to come and to fill the gap because we have a gap. We can start taking medical general practitioner, nurses, and start training them how to follow up a patient who is under resuscitation, ventilator, and also training on this disease, which is a new disease.
The shortage of health specialists during these times of COVID-19 is a concern faced by many countries worldwide. That is why medical specialists say it is preferable to prepare for a worst-case scenario, even if the need never arises.
Immediately the first cases of COVID-19 were confirmed in Cameroon, public authorities instituted the toll-free number 1510 to mobilize rescue teams in cases of need. But some callers have been expressing frustration that their calls never go through. Constantine Bomb took their worries to the Health Emergency Operations Center and brought back this report.
Amongst the series of measures to help contain the spread of COVID-19 in the country, Cameroonians were urged to call the toll-free number 1510 that will help response teams meet them. The number has been of great help to some Cameroonians who managed to get their calls through to the emergency response team. The challenge faced by some Cameroonians is that not all 1510 calls go through.
There are many people who call to signal alerts or to have some information. From now, we are receiving more than 1,000 calls per day, and maybe there are more than 1,000 other people who try to reach the 1510. The capacity of the center is loaded, but we are working on it by the decentralization of the call center to the other region.
For those who succeed in talking through 1510, response teams are usually dispatched to meet the callers.
The process is that the rapid response team should go on the field to find out if he is a really suspected case of COVID-19. If it is the case, and they will take a sample to bring to the lab. But if it is not the case, they will orientate him to have the best management possible.
Another problem is on the time that a suspected individual has to wait for his or her results.
Normally you have the results of the test in few hours, but since we have many cases now and many samples to test, the time of result is delayed. So the minimal time will be 40 hours or 48 hours.
The government has already launched an intensive mass testing following a tweet of the Minister of Public Health on March 23.
Now it's only in Douala that a massive campaign has been put in place to screen the entire population of the town. In other regions, in other towns, we are still just testing the suspect case and the people who have been in contact with positive case of COVID-19.
Cameroonians, however, continue to await the announcement of COVID-19 testing centers, as the government has earlier indicated that the testing will be decentralized as well.
And this press release from Cameroon's Minister of Territorial Administration, Paul Atanga, it reads, as part of the fight against the spread of coronavirus COVID-19 in Cameroon, the head of state, His Excellency Paul Biya, has prescribed salutary measures which have been relayed by the Prime Minister, head of government. The measures include the closure of borders, the closure of schools with e-learning as an option, the closure of drinking spots, restaurants and recreational centers by 6 p.m., the prohibition of gatherings involving more than 50 persons, the limitation of the number of passengers in public transport vehicles, the hygiene measures like regular hand washing and putting on face masks. In addition to these measures, the head of state has created a special National Solidarity Fund intended to finance operations of the anti-coronavirus strategy. Cameroonians and partners of goodwill will already made significant contributions into this fund or have already made significant contributions to the fund. The Minister of Territorial Administration has noticed with dismay that leaders of some political parties and associations have called for public fundraising allegedly for the same purpose in defiance of the legislation in force. The minister would like to remind here that fundraising in the event of a crisis or disaster is regulated by Law Number 83/002 of 21 July 1983 governing appeals of public generosity and Decree Number 85/1131 of 14 August 1985 to lay down the conditions for authorization of an appeal for public generosity. The provisions of these legal instruments formally prohibit any individual or organizations of any kind from calling for public generosity without the due authorization from the Minister of Territorial Administration. The Minister therefore calls on all those who have taken upon themselves to organize these illegal fundraising activities to stop immediately, to close any bank account open for this purpose, and to report to him as soon as possible without prejudice to the penalties provided for by the legislation in force. Any citizen or organization of goodwill wishing to contribute to the fight against coronavirus can do so in all transparency within the framework defined by the head of state and implemented by the Prime Minister, head of government. Banks and microfinance establishments lodging these accounts without any legal backing are called upon to close them immediately. They can only be reopened upon explicit authorization from the Minister of Territorial Administration, and defaulters shall be punished in accordance with the laws in force. It is signed Paul Atanga, Cameroon's Minister of Territorial Administration. Health officials in the northwest say there is no evidence to prove that the region has recorded its first case of a confirmed COVID-19 infection. Latest information suggests that the lady who is suspected to have carried the infection to the northwest did not get into the region. Mercy Kusi has the details from Bamenda.
The Northwest Regional Delegate of Public Health, Kingsley Chesaw, says he and his team have been on their feet ever since a lady who is reported to have gotten into Yaoundé from Kenya and was tested positive of the coronavirus was said to have gotten into the Northwest region.
As far as this case is concerned, on her investigation form, it is noted that she is resident in Bafoussam. And therefore, when her results came out, the results were shared with the regional delegate of the West region. Since the regional delegate of the West region tried to get to her and she said she was in the Northwest region, he had to obviously get to me and share the results with me so that I could trace her, and then we bring her to the hospital for treatment. That's how I started communicating with her. But unfortunately, she's saying now that she's not in the Northwest region, that she is in the littoral region. At this particular point, we cannot attest that she is in the Northwest region. What we can say is that she's positive for COVID-19 because I have her results from Central Pasteur. We have the right to think that she may be somewhere in Cameroon, and she doesn't want to disclose her location.
The health officials of the Northwest have assured the public that they are doing everything at their level to stop the virus from getting into the region, but the public also has a huge part to play.
We've been investigating at the level of Santa to make sure that we are able to master every case that we think is a suspected case. We have the entry point at the level of Widikum, where we have been informed that the traffic there has been high over the last week. So I'm already mobilizing a team that will go to Widikum and start testing in a couple of days. We are going to also see how we can place teams at the level of Dunga Mantung.
Investigations are ongoing at the moment to know the exact location of the said woman.
The governor of the West region has once more enjoined the population to show responsible behavior to check the spread of the COVID-19 in that region. Our Fonka Augustine was speaking during a meeting in Bafoussam as Ngu Henry reports from the West region that now counts 44 cases.
This meeting permitted members of the regional committee to assess measures taken to combat the coronavirus in the West. The region now counts some 44 confirmed cases of the coronavirus. The patients are at the Bafoussam Regional Hospital and the low-cost houses at Kwekong, some 16 kilometers from Bafoussam. The governor of the West region has instructed those charged with potable water and electricity to ensure constant supply in the hospitals and the low-cost houses. Our Fonko Augustine has called on all to put hands on deck and check the spread of the COVID-19.
The COVID-19 is a crisis that, if well prevented and well managed, the casualties will be minimal. But if good measures are not taken, the consequences will be catastrophic. So let everyone get on deck, let everybody get on board. Administrative authorities, municipal, forces of law and other medical team and all the rest to make sure that.
Meanwhile, some 300 patients have so far availed themselves of the unit of the management system through the numbers 677-8933-280, 677-897287.
4 coronavirus cases have been confirmed in the South region and 21 suspected cases reported. To contain the spread of the virus in that region, health personnel and administrative authorities have intensified sensitization campaigns urging the population to respect restrictive measures put in place by the government of the Republic. Details in this report.
This is Mekamevom in Mengong subdivision, where the first 3 coronavirus cases for the South region were detected last April 3. The inhabitants are going about normal business, while health and administrative authorities struggle to contain the spread of the pandemic. From 34 alerts, 4 cases have been confirmed, 21 are suspected, while 19 samples have been extracted and forwarded to Yaoundé for screening.
These people whose cases were confirmed as positive are now at the regional hospital. We are still waiting for the result of others who were in contact with the confirmed cases. The results are still awaited.
Committee Chairperson Felix Ngelengele has condemned the stigmatization of confirmed and possible cases with the assurance that adequate measures have been put in place to ensure a smooth follow-up. Members of the South Regional Committee for the Fight Against COVID-19 have been challenged to collaborate in barring the way to the deadly enemy through the strict application of the 13 measures prescribed by government.
There is still a lot to be done in terms of respect of these directives at the level of the population, and we gave some orientation on how to deal with those who are contravening the government directives.
Committee members also visited the various checkpoints at the entrance and exit of the regional capital to evaluate the efficiency of the hand washing and temperature taking mechanisms imposed on travelers.
COVID-19 infected persons in Douala will be transferred from hotels to health facilities for appropriate health care, while those tested negative will go back home. This is the outcome of an evaluation meeting in the Littoral Governor's Office. Sally Ebenyenyoki reports from Douala.
Following an increase in the number of COVID-19 cases registered in Douala within the past days, the incident management system set up in the littoral region has put up a dynamic response plan. Apart from taking care of COVID-19 infected cases, they educate the population to respect measures of hygiene, track suspected cases, screen those at risk, implement hygiene and sanitation, and also carry out epidemiological surveillance. For an efficient and effective follow-up, 5 health institutions have been retained. They are the Ghana Obstetric and Pediatric Hospital at Yessa, the Lakentini Hospital, the Logbaba District Hospital, alongside the Bonamusadi and Kololun Subdivisional Medical Centers with up-to-the-minute equipped laboratories. 2 major decisions were arrived at during the meeting of the incident management system.
As from this afternoon, we are going to send all those people who were confined in the hotels who are tested negative, we go home normally.
Camtel has announced the availability of 7 telephone lines at the Littoral Delegation of Public Health with a promise to extend to the different health institutions. Meantime, medical personnel are on the field to track and screen COVID-19 cases, while community health agents are sensitizing the population. Another team is carrying out investigations and rapid intervention to curb the spread of the COVID-19 virus within the community.
The School of Technology of the University of Douala and its partners have begun the mass production of hand sanitizers recommended by the government of the Republic. Gladys Atemba Chechuma Banda reports.
In times like these, when complex scientific problems in the likes of COVID-19 emerge, the academic and scientific machinery of every country gets activated. The School of Technology of the University of Douala is on the front line for these calls. They are on a mission to produce hand sanitizers to fight the pandemic.
On the first strata, we have research lecturers, then professionals from enterprises, followed by students of IUT who are learning by doing.
The research team has made recourse to local raw materials like the popular aloe vera plant, which they say has several tested and proven medicinal virtues.
Beyond its gellifying function, aloe vera also plays an antimicrobial function. Instead of depending totally on imported raw materials, we can use our local plant resources.
The machines of the IUT factory are turning at full gear on a daily basis to produce the requisite quantity.
We produce about 1,500 pieces daily. For the 100 milliliters specimen, we produce practically 2,500 pieces.
The initiative is a cooperation platform between the University of Douala and the enterprise world.
Within the framework of the implementation of measures to counter the spread of the coronavirus, the Minister of Transport, Jean-Ernest Masséna Ngalebibehe, hereby informs the public that henceforth public transport passengers are expected to put on a face mask before boarding any mode of public transport. It is signed Transport Minister Jean-Ernest Masséna Ngalebibehe. Some private clinics have opted for online consultations to the patients while keeping safe from possible coronavirus infections. An example is the Frantz Fanon Medical Foundation in the nation's capital that uses the internet and other communication technologies for healthcare delivery. Yoti Kaleli Songa reports.
No entry henceforth for all patients, but they can consult using the internet and communication technologies.
Good morning, Madame Ebonge. We just received now the results of the urine and the biology of Thomas. There's nothing to say wrong about it.
About 6 calls are received daily as opposed to the 35 to 40 physical consultations per day. Before the management of this clinic opted for teleconsultations to curb the spread of the coronavirus.
It's our first experience. The surprise is that it's working more well than we thought. The truth is that it's asking a lot of concentration. It asks to have more details about the story of the disease because you don't have the patient in front of you to put a diagnosis on and to decide what are the exams you need for this patient and what is the treatment that you need to give to him. You need every day to see how he's improving since you didn't see him physically.
Their teleconsultation services for 0 to 18 years old are available 24/7 at the cost of 6,000 CFA francs sent to the clinic via electronic payment systems instead of the usual 15,000 CFA francs for uninsured patients.
In this period of epidemic, when a child is starting coughing, when a child is starting sneezing, when a child starts fever, parents just think about that. That's normal. A suspect case is based on the history of the patient, the history of somebody close that traveled in one of those countries that is affected by the epidemic, the symptoms that he presents.
Even though there's some success recorded, especially in detecting suspected coronavirus cases while keeping safe, the medical staff regret that poor internet connections do not make their job any easier.
Cameroon has recorded 27 new cases of the COVID-19 disease. The information was disclosed by Public Health Minister Dr. Manauda Malache during his daily update on the situation. And standing by at the Emergency Operations Center is Rahanatu Sali to tell us how the situation is unfolding in the country. She is in the company of an official of that center. Now, Rahanatu, what is the situation out there now? Here you are the guests.
Good evening, Edwin. As you rightly said, the figures keep increasing. 27 people have been confirmed positive of the COVID-19 today, meaning Cameroon now counts a total number of 685 COVID-19 cases. 5 regions have been affected, that is the center, littoral, west, southwest, and the south region. True, the figures keep increasing, but the good news is that 43 people have recovered and are doing well. My guest this evening is Ngo Bakale Manuela. She is in the Public Information Office here at the Public Health Emergency Operations Center. Good evening, madam.
Good evening, sir.
Now tell us, despite the figures that keep rising, 43 people have recovered and so far they are doing good. What is your opinion on this?
Well, let's say that the recoveries are very encouraging. This shows that the effort of the different teams are fruitful. And it also shows that when diagnosed early, the probability for the treatment to be successful is very high.
Now, what about the COVID-19 pregnant lady who put to bed a few days ago? How are mother and baby doing?
The mother and the baby are doing well. Both are taken in charge in the hospital. And it shows that the teams are working very hard because having such a result is something very great. And we seize the opportunity to wish to everybody, all the personnel, all the health personnel, a wonderful World Health Day, despite the context which is very difficult, but we know that, well, by struggling we will reach.
And as you said, despite the good news, we do not need to relent in our efforts against COVID-19. At this stage, what do we need to do so the figures do not keep increasing?
Well, we should continue because it is a very long process. So what we have got, we should put it in practice. Those are barriers rules. We should keep on washing our hands. We're running cold water. You should sneeze or cough in the crease of your elbow, and you should use a tissue when you need to cough, where you should keep on practicing all those barriers rules.
Now we have COVID-19 carriers who never came, left the country, or who never came into the country. We have them in Cameroon already. At this stage, what do we need to do to stop the disease from spreading further into our communities? Do you think at this stage it suffices to say people should continue observing basic hygiene?
It is true that the main key process in this fight, it is respecting the basic hygiene rules. That is washing all the places that has been contaminated. Because when you go, for instance, in the market without wearing a mask, you are exposing yourself, because maybe you don't know whether you are safe or whether you are ill. And if you are ill, it means that you are exposing the others. So when we are keeping those rules, that we should stay at home, when I stay at home, taking all the measures that has been prescribed, well, I protect myself, but also I protect the other selves. So plus all those different rules of hygiene that we have talked about, we need to, well, limit our movements in the streets.
Thank you very much, Bakale Manuela, for your availability.
Thank you, sir.
Well, Moki, I think Cameroon is rising up to a bigger challenge of the COVID-19, but according to officials of the Ministry of Public Health, the approach that is being used right now, that is active surveillance of cases and sensitization, is yielding fruit. And just to add that the Minister of Public Health, in a tweet earlier today, congratulated all health personnel who are putting their lives on the line in order to save infected persons. BrigadeAntiSardinard from the Public Health Emergency Center for the 7:30 News.
Well, thank you very much, BrigadeAntiSardinard, and have a nice time out there. Now, municipal authorities and law enforcement officials are on a repressive phase to ensure that motorcycle riders in Yaoundé respect social distancing norms instructed by the government to limit the cycle of the coronavirus. Ewanepule was on the streets of Yaoundé today to take stock of the situation. His report.
Commercial motorcycle riders in the city of Yaoundé are adamant to government prescription to avoid overloading. Doubling passengers is a daily occurrence. Moreover, they are still not respecting social distancing norms.
When we carry one man here from today and come back here, the thing is not even moving well. If they can even reduce the price of the fuel, it can be good.
If you carry 100 francs from here to today and come back, you won't have anything for the day. That's why we are forced to double people so that they will pay us fine. We are afraid of coronavirus. Things that life is very, very difficult on us.
However, law enforcement officials, in collaboration with municipal authorities, are on the repressive phase, tracking and sanctioning defaulters.
Or they feel we have the municipal police, we put them in the checkpoint now. With them, we try to work anytime, and the result, I think, is good for us and to everybody. The measure we take when we meet this kind of situation, the motorbikers is bound to pay 25,000.
With these measures, it is expected that commercial motorcycle riders will respect government prescription to limit the spread of the COVID-19 pandemic.
Trade unions and staff representatives are pleading with employers to consider the safety of their employees during this period of COVID-19 at a video conference chaired by the Minister of Labour and Social Security, Gregoire Awuna, in the presence of officials of ILO in Yaoundé. A clarion call was made for workers to remain productive in spite of COVID threats. BrigadeAntiSardinard reports.
Apart from the fact that the COVID-19 affects public health, the impact is huge on workers' productivity, especially those from the informal sector. 25 million workers are going to be rendered redundant as a result of the COVID-19 pandemic, according to the International Labour Organization statistics. It is within this backdrop that officials of the Ministry of Labour and Social Security and those of the International Labour Organization had a social discourse through a video conference on the health and social benefits of workers.
It is the government, of course, who is in the leading role, but also we need the workers, we need employers, with all structure or people to ensure that there is a national solidarity, because we have to fight this pandemic.
The Minister of Labour and Social Security, Gregoire Ouna, has acknowledged the role of trade unions in creating awareness on occupational safety and health at work.
Trade unions play a key role when it comes to occupational safety and health. And with COVID-19, trade unions will have to apply measures of occupational safety and health at the workplace. And this means, in very short and simple way, that unions will have to educate their members, the workers.
In all, the COVID-19 pandemic remains a contemporary challenge that requires a prompt and extraordinary attention of all.
The Member of Parliament from Fundi 6 has donated some preventive kits to commercial motorbike riders to support the fight against the spread of the coronavirus. While handing out the items, Honorable Meno Judith urged them to make a judicious use of the gifts. Kwancha Marikledo reports from CTV Center.
The preventive kits comprise hand sanitizers, masks, gloves, jackets, as well as washing soaps and buckets. Handing over the gifts in the presence of the DO of Yaoundé 6, Etundi Joseph Allen, the Member of Parliament for Fundi 6, Meno Judith, says it falls in line with one of our parliamentary missions, that of assisting the population wherever need be.
The government has done a lot to stop the spread of this deadly pandemic. So I thought that the motormen who are the most exposed, they go out every day to look for their daily bread. They carry people on the bike, they interact with people every day, so they are really exposed, and they can also be agents of transmission. So I thought that beginning with them, supporting them with these items will help to prevent the spread of the disease.
The beneficiaries on their part saluted the gesture and promised to work together to halt the spread of the COVID-19 pandemic in the environment.
I just want to appreciate this, our mother who just given of this token for us to prevent this virus that is worrying not even our country but the entire nation. We are going to present it to people how they are going to use it to protect themselves.
The exercise that took place at the DO's office was also an opportunity for a health expert to educate the bike riders on some preventive measures.
Elites of the Mungu Division have also donated kits to help curb the spread of the COVID-19. The hand sanitizer, soap, water containers and masks were donated during a sensitization tour led by the CPDM Central Committee member El Haj Umaru. Victor Siga reports.
Hand washing has become a gesture that must be repeated several times a day in order to reduce the danger of COVID-19. These members of parliament and locally elected officials who have taken the fight to heart so as to protect the population have just carried out the necessary measures by this act.
We are playing our role by helping our population, by sensitizing them and helping them washing their hands. But other action will be in accordance with the authorities.
From one subdivision to the other, the kits they donated were installed in public places and strategic points to stop the virus from spreading amongst the population of the Mungu.
Our government, President Paul Biya, has taken important measures, and we have to respect those measures. Our parliamentarians decide to bring their contribution to our division. This gift is an important gift, and we hope that population will take care.
The gesture was also made possible thanks to the high contribution of the Minister of External Relations, Le Jeune Bella Bella.
The death toll from COVID-19 has increased to over 79,148 in the world. China has not recorded any deaths today, while South Africa has been declared the most affected in Africa with 1,749 cases. BrigadeAntiSardinard has an update.
The COVID-19 situation in the world continues to be dicey. It will go on record that this is the first time since the coronavirus broke out that China has not recorded even a single death this Tuesday by the time of this report. In France, its government has revealed that most people are refusing isolation. What a difficult equation to solve. Spain has recorded more deaths today as compared to yesterday, plus 556 new deaths have been reported. Italy remains the most affected as far as deaths are concerned. They now total 17,127. The African continent multiplies rescue efforts to minimize the incidence of the ravaging effects of the virus. The country of Cyril Ramaphosa, South Africa, is the most affected on the continent, with 1,749 confirmed cases this far, with 14 deaths. Algeria follows with 1,468 confirmed coronavirus cases. That has led to the demise of 173 of its citizens. Egypt is third with 1,322 confirmed COVID-19 cases and with 85 persons losing their lives to the virus. Morocco is battling with the reality of 1,141 confirmed cases. 84 of its citizens are no more. Let's put the cap on this day's COVID-19 update in Cameroon, where 658 persons have contracted the virus, with 60 recoveries and 9 deaths confirmed by the Ministry of Public Health.
On to other news, the CPDM party has won all of the 13 National Assembly seats that were up for grabs in a partial election rerun in the northwest and southwest regions. The results were proclaimed by the Constitutional Council in a session chaired by its president, Clement Atangana. Quinta Rita Edang reports.
A calm and serene atmosphere in the courtroom of the Constitutional Council as the 10 members of the legal structure, headed by Clement Atangana, answered present to proclaim the results of the last March 22 legislative by-election in 11 constituencies in the northwest and southwest regions, all won by the ruling CPDM.
I feel happy that democracy has once more been put to test. My people actually demonstrated their love for me, their love for my candidacy, and they voted me, and today I've been proclaimed the winner of this election.
I feel contented because it has come to demonstrate that our country is a country of law and legal aspects were respected.
President Clement Atangana explained that the rerun was the outcome of some 40 petitions tabled before the legal unit by different political parties, notably the SDF, complaining about the poor conduct of the February 9 legislative election, which led to the cancellation of the exercise in these areas. Florence Rita Array took the floor to give the details of the exercise, which saw the victory of 13 CPDM candidates, 12 in the northwest region and 1 in the southwest region, making a total of 152 seats for the ruling CPDM. According to statistics presented by the Council, over 423,000 voters registered in the different areas concerned, with about 40,000 effectively voting, giving a 9.50% participation rate. He hailed the contribution of Elections Cameroon, the Ministry of Territorial Administration, the media and other actors for working in synergy with the Constitutional Council to enhance democracy in Cameroon. The 13 new MPs will therefore add to the already elected 167 to make a full house of 180 parliamentarians.
And that will be after their mandates should have been verified in the sessionals of rights. That ends the 7:30 news on CRTV. Join Adem Bala at 8:30 for the news in the French language. I am Moki Edwin Kinzeka in Yaoundé. Thanking you for watching.